Hello and welcome. This is Mary Peters. I am going to be doing a product focus today on our product Glucaffect. This is probably one of my favorite products just because when I practiced as a nurse for 17 years, I worked with heart patients and I also worked with diabetics. I did diabetic teaching. And the thing that I love about this is that Glucaffect is a nutraceutical, a nutrient that works at the epigenetic level that helps to lower blood sugars naturally, and it also has a lot of other health benefits. And I'm going to go through this right now. So the Glucaffect is a nutritional product that has clinical studies that were done, and it was an 8-week clinical trial with individuals that were overweight and also had high glucose levels. If they took up to 4 daily servings of Glucaffect every day, they were able to lower their fasting blood glucose by an average of 30%. So if you have someone who has a fasting blood sugar of around 200, they would see a drop of 60 points if they were using 4 times a day, the product 4 times a day. And then there was also weight loss involved with it as well. Now, we do have a nutritional panel with this product, but I'm going to go through some information from our product information flyer. And when you go to our website, each of our products has its own individual page with a product flyer, benefit sheet, and a guide. And there's usually posts on our Relive blog that talk about the product. So I'm going to go first to our product information flyer. Now, what this talks about is the clinical study. Again, it talks about the 8-week placebo-controlled clinical study of individuals that lowered their blood glucose and were also able to see weight loss. And the reason that they saw weight loss is because the Glucaffect has special ingredients that help you to feel full longer. It slows down the rate at which your body metabolizes the carbohydrates. So you just feel full longer, and your blood sugars stay more stable. And it also helps with weight loss because when you feel full, you're not going to be eating as much. The benefit sheet is a little bit more of a description, tells how there's 45 servings per can and just the scoop size. And we do have a U.S. patent on this with cutting-edge nutrition. Again, it talks about our 8-week clinical study and something important called pycnogenol. So this is an extra ingredient in the Glucaffect that helps, it's an antioxidant, and it does help to lower blood glucose levels, LDL, blood pressure, and it just improves your overall health. Omega-3s are very good for cardiovascular health, maintaining your blood pressure and your cholesterol. And cinnamon is actually a very natural way to lower your blood glucose levels. So again, you're doing this by using nutrition to help control your blood sugars rather than medication to control your blood sugars, which usually will come along with side effects. Most medications do have side effects. This is our guide. It's a 5-page guide, and the reason I like this is because it goes into the detail of what, who would actually use who would use this product. And I'm going to make this a little bit bigger here. Okay. As you can see, we are a nation at risk because many people suffer from something called metabolic syndrome. And metabolic syndrome is 1 in every 4 American adults that will have this. It consists of 5 different criteria: high blood pressure, high blood sugar, high triglycerides, elevated abnormal cholesterol levels, and excess body fat. And when you have metabolic syndrome, what it does is it increases your risk for other chronic diseases: diabetes, obesity, heart disease, and stroke. So someone who has metabolic syndrome actually increases their risk for these diseases. Now let's say, what are the criteria? Well, on the far right, it shows you the criteria are elevated blood pressure over 130 over 85, glucose over 100, triglycerides over 150, your HDL, which is your good cholesterol. If it's less than 40, that's not good. And how big is your waist circumference? That is another important factor in measuring for someone who has metabolic syndrome. This is not a disease, it's actually a syndrome. So what it does is it sets you up for other possible chronic diseases. So by using the Glucaffect, you're able to decrease your risk of some of these chronic diseases. Now, this is a really great piece of information here that talks about the pycnogenol is actually from a French tree in France that has a lot of healing benefits and antioxidants. It helps to lower blood glucose levels and improve cardiovascular health. And then this is another ingredient that helps to lower the blood sugars. And, these are coming from a lot of different areas. This is from India. The Glucahelp is something from a tree. It's a tree extract that helps to lower a certain acid in your body that will help to give you a lower glucose level in your blood. And the thing that's, again, that all of these ingredients are natural and they don't have the side effects. So it's important to understand how when you're controlling your health, we don't ever want to estimate the power of what nutrition can do for our health. This is a more detailed study of, the actual clinical study that shows the Glucaffect and how it kind of lowered the blood sugars. And again, we talked about the 30%. On an average, it would be lowered up to 30%. And then also A1C is something that kind of measures something more over a period of time, like a 3-month time. And so that's another way that you're able to watch your blood sugars. And then this last page just talks about, Dr. Carl Hastings is the one that actually helped to create and get the patent on this. Now, our Relive blog, the reason I love this is because this has real-life stories. And when you go to the blog, it just talks about, soy is much better. The Glucaffect has a naturally occurring peptide called lunasin, and lunasin is a peptide that's in soy. So the lunasin protein is in our Glucaffect. Right here it talks about the Glucaffect having luna-rich, or lunasin is another name for it. We have a patent on this product. And then these are nice, really great stories about a gentleman from Milwaukee that saw results with his blood sugar finally going down after many years. Another gentleman, Mark from Georgia, who lost weight by adding the Glucaffect to his regime. And then this is a family in Idaho Falls, Idaho, that talked about just having results within their own family with the Glucaffect. So this just kind of gives it more of, this is an actual reason that people are using it, because they're getting real results. And it really does, it delivers what it says it's going to. So again, we'll go back to the product page, and you can find all of this at relive.com, and you would go to products, and under the products you would just go here, and you'd be able to scroll down. We have a lot of different products, but you're going to scroll all the way down to find the Glucaffect. So thank you for listening, and if you have any questions, you can get back to the person that introduced you to Relive, and they can give you more information about how you can get started on the products. Thank you.